Here. There you go. Very nice.
I floss 3 times a day. No, you do not.
Correct.
Sir.
I never lie to my dental hygienist because they know. They know.
It's worse this way. When I do this, I can really feel it all the way down to my middle finger, to the point of my middle finger.
Yeah, that's.
And it's starting to go numb. So I have my biggest, if I had to say my chief complaint now in my life, is my neck. I have tender spots. I can feel them. I'll have to massage it out before I can pop that part of my neck. My head just always it just doesn't feel like it's in the right spot. Okay. Into my shoulders as well, and then I'll have back pain kind of in the middle of my back. Okay. Periodically, I get pain in my hips, and I can only describe it as it feels like it's in that joint, wherever that socket is. I can't point to it because it's inside where it hurts. But that comes and goes. Okay.
Headaches, how often?
They're less than they used to be, but probably once a week.
Okay. It says numbness. Give me an idea of where is it intermittent? Is it on all the time? Or?
So this has been within the last year or so, and it's in my hands, my wrists. Actually watched a video of yours recently where you were talking to someone about carpal tunnel, and you did this test. Valence. I do think it's carpal tunnel, but my mom had it severely. She had the surgery like 20 years ago, and it's never come back. But this will cause my hands, just if I stay like this for a minute, this starts to hurt and go numb. But even without that, I type a lot. I do a lot of, I'm crafty, so I'm doing this all the time, and they'll go completely numb. I'll wake up like that.
All right, so just real briefly aside, the median nerve controls your thumb, index, and half of your middle finger. And so for everybody at home, it's called Phelan's and reverse Phelan's test. This stresses the carpal tunnel. So if this creates wrist pain, that's not a positive Phelan's or reverse Phelan's. It's simply when you do this, if there's an exacerbation of a numbness symptom in this region when you're doing that test, that means there's something going on with the carpal tunnel. Because
I feel it here, right in the base, and up this finger and through my thumb mostly.
And it gets worse when you're doing this.
Yeah, like I wasn't feeling it before I started doing this. I first start to feel it in that palm of my hand, maybe here to here a little.
Yeah.
And then it's worse this way. When I do this, I can really feel it all the way down to my middle finger, to the point of my middle finger. Yeah, and it's starting to go numb.
Yeah, it means it's called the median nerve through that carpal tunnel. There's a tendon that goes through there, flexor pollicis longus, FPL. But when you're moving that wrist around, it compresses the contents of the tunnel.
Yeah, and I'll sit here and kind of prolong this, and sometimes it will. I feel it's crunchy.
We'll work on it. But you're doing a lot of typing. You're thinking.
I type a lot, painting, small arts and craft, diamond painting. I don't know if you've heard of that. And that's when it's bad. I'll be doing things I like to do, and my hands are going numb. Okay.
So the head is like about a 10-pound bowling ball, and like if I held a bowling ball towards my body, it's not as difficult. I hold it out in front of me, outstretched. My muscles have to work harder.
Yep.
So the posture your work requires puts you in a position where you're looking down or writing and typing and doing clerical work, so that the stress on the muscles get tight, the joints actually then get inflamed. An inflamed joint, think of it like a capsule. So when a joint gets sprained or hypermobile, it swells up. There's air bubbles inside that capsule also, and that's what we're doing when you pop a joint. You're releasing some of the air bubbles from that pressurized capsule, which then gives you temporary relief. But the problem is, because you just popped it, it then swells up more air bubbles diffuse from the bloodstream in, and then he keeps this positive feedback cycle.
Yeah, that makes sense. So I'll tell you where I think the root of this, when it started, I was in college, my early 20s, and I have attended, like even right now, I'd like to be sitting cross-legged. I don't feel comfortable in this position, and I've always kind of been flexible. So I sit cross-legged, and I was never comfortable at a table. So for 6 years in school, I was sitting either in my bed or a couch, cross-legged, leaning forward, doing my studying, whatever. So I know that's the hip pain started, and I know that's got to go because I'm hunched. It's the whole body kind of crunched over.
Especially in your 20s, the discs are non-sensitive, and the position you're talking about, cross-legged and then being bent forward, puts an immense amount of interdiscal pressure.
Mm-hmm.
At the end of the day, my core philosophy is restoring posture, restoring the alignment as best we can back to these lordosis. The curves in our lumbar and our neck, we don't have them when we're born. We develop them in the first year of life. These curves allow our spine for the weight to be spread over all the segments. What we typically find, and I love dentistry because it's very analogous to chiropractic in many ways, the discs have no feeling, the enamel has no feeling.
Yes.
The discs don't regenerate, the enamel doesn't regenerate.
Right.
The most important structure in your mouth is the enamel, and the most important structure in your spine is the disc.
Okay.
And so the alignment of your teeth matters, and the alignment of your spine matters. So everything directly correlates with what you guys do.
Yeah.
Dentists don't use pain as the criteria for care. Oh, your teeth feel great. Have a nice day. Have a nice.
Pain means then something's gone too far.
Correct.
Yeah.
There's been decay for years before there's symptoms.
Yep.
Everything, discs, injury. People can have a disc injury and you have no awareness of it until the disc hits the nerve, because the disc has no feeling.
You have no awareness of a cavity until the cavity hits the
the
nerve.
nerve.
Interesting.
Right. So
Okay.
everything directly correlates. Something a little different than dentistry is the fact that 5 vertebrae have 99% of injury. So just pure statistics on terms of the spine, these last 2 vertebrae in the lower back and the last 3 discs in the lower neck encompass about 99% of problems. So we're seeing a pattern based on alignment and mobility.
I think I'm your textbook case, and because I watch you and I listen, this is what I like the most, I think, and what made me want to come see you, because I'm like, when my head feels heavy in the car, I know that my lower neck is begging something else to do a job.
Correct. It needs a break.
And so I'm excited to learn about my body and kind of where things are for me. And then also, like, I'll lay on a roller.
Excellent.
But I'm like, am I doing it right? Is it in the right spot?
The roller's a good beginning tool. It's a great way, I think of it like a toothbrush. There are great ways to begin the process of brushing the spine.
This might be a weird question, but other than the postural things I've already told you about, something I did for a long time was I didn't have like a TV or anything, a laptop. So I would lay in my bed on my stomach like this.
Yeah.
Between my hands.
Yes, ma'am.
So from everything I've learned, most people have, I don't have the texting, I'm not on my phone a lot, so I don't have this problem. But I know that most of the time in life I'm probably like that. But I almost worry because I also overstretch this way and collapse. Which way should I go?
Right. The difficulty is that, I'm going to feel your spine in a second. I'll give you a better assessment. Okay. My worry is for a lot of lay people or people that aren't adjusted, when you do that type of maneuver, it's possible that you're only bending in the lower neck.
Okay,
because
I probably am.
Because that's where your neck likes to bend. And so you can get in a little trouble.
And I get a lot of pain from it.
Right, you might get pain from it because you're bending too much where your back has been always bending. Again, that's where, after a handful of adjustments, we should get you to a place where that position is safe and beneficial, but not yet. We need to make sure the whole spine's working.
The upper part too, okay.
Shoulders elevated, okay. There we go. Left hip is high, left hip's high. So your body's trying to get away from this right side. Your body will misalign the hips, it misaligns the shoulders, what we call antalgia. Your body, if I have an injury on the right side of my neck will tilt to the left. I can't walk around with a tilted head, so I'll drop a shoulder. We call it a righting reflex. Same thing happens with the hips. If I'm hurting here, my body will tilt my hips to find relief. This is not complicated. We don't need to be putting shoe lifts in. We don't need to be chiropractically trying to undo what the body intelligently does. We need to fix the reason for why it hurt, which created the shift, right? So chiropractors can get very lost, I call it, in symptomville, chasing symptoms. I'm not a symptom doctor, I'm a postural doctor. There we go, okay. Any pain when you do that?
It's tension. I feel like a little spasm.
On the left or right or both?
On the left.
So you turn head left, pain on the left, turn right for me. Okay. Any pain on the right or left?
Yeah.
On
right.
both sides? On the right side?
On the right, mostly.
Okay, down here on the bottom, do you think?
A little lower.
Okay.
It's almost like here.
In between the shoulder blades?
A little bit, yeah.
Okay.
Yep, right there.
Okay. And then go ahead and look straight forward again, and then look up for me. Okay, yeah. Any pain when you do that?
Crunchies.
Just crunchies? Okay. Look straight forward, you're fine. So this is the principle of what we call referral pain. Come over here. You know, the joints will refer pain. The knuckles, when you're overstressing these knuckles, right, kind of where you were pointing,
Yep.
we call that irritation of the joint in the neck, cause pain in distant areas. Embryonically, these two areas are connected. And so when there's inflammation here, when you're turning your neck, this area is stressed, and that's why you're then feeling it here. And you can
Exactly.
you can rub this forever, you're never going to fix it. We got to take stress off the lower neck. Why is the lower neck stressed? Because there's no curve, because heads forward. Oh.
I'm laughing because just looking at this, exactly where that arrow points is where it hurts on the right side for me, and exactly where that arrow points a little lower. Is that me?
Right, this is a cool picture. It's a cool picture because it shows that pain is in distant areas, that the lower neck joints will give you pain here, and what happens is the ribs will also be inflamed, so they're connected. It's not just that. When your head goes forward, the ribs elevate, so there can be rib inflammation too. There can be tight muscles that build up lactic acid, so you'll have tension, but that pain that comes when you just turn your neck is because of inflammation of the lower neck joints. Time to put them on vacation.
Makes sense.
Have you on your back?
Excited.
Now, you've never been adjusted, is
Ever.
that? Okay, all right. So there's no bones breaking. There's no bones rubbing together. There's simply, we're trying to loosen the joints. And when we loosen a joint, the air that's in the joint will get released. That's not actually even the purpose of the adjustment. Is the goal to see how many pops I can get? No.
Yeah.
We're trying to adjust what's tight and leave alone the loose ones.
I have no fear. I'm super excited.
All right. Cross your arms for me. All right, bend both the knees for me. I'm going to help you do a little sit-up. Take a deep breath in. And just try to relax your chest. There you go. Deep breath in. I got you. Head back. Exhale. There we go. Deep breath in. I got you. Let it go. Exhale. There you go. Stay there. Okay. Yeah. This one, Bet. You got it. There you go. Put the hands around your belly. I'm going to have you put the back of your head in that little slit there. That'll hold you from turning beautifully. Take a deep breath in, and then exhale. I got you. You're not going to fall, I promise. Here we go. Good. Beautiful. Beautiful. Other side for me. Notice the clunk. That was the SI joint moving. So we're not, I would hope any chiropractor, if you're, not that you're going to see another chiropractor, but in case I will live forever, nobody puts their hand in your lower back, is my point. Okay, I'll briefly show you. I don't want anybody contacting your lower back. We're trying to move the SI joint or the joints above. Take a deep breath in. Exhale. Good. Let's go face back on your back for me. So chiropractically, the reason why we're adjusting the spine is we're trying to only adjust what's not moving and to not adjust what's moving too much. The difficulty is that when you adjust a joint that's hurting, you'll get temporary relief, just like you're doing yourself when you self-pop, right? So chiropractors will get lost continuing to adjust an area that's already loose to give temporary relief, which means I'm being contrasted to like a bottle of Advil, right? I'm not here to just give temporary relief. My job is to correct the problem so that you don't even need to come into a chiropractor's office that often. Now, that's not a very good business model. Not a very good business model to tell people to take care of themselves at home, right? Which is why you tell your friends about me, and then something like 15% of the population even goes to a chiropractor. So we need to get people trained with toothbrushes and floss. Do you understand? And then yes, you need some level of observation. Hey, you're missing a spot here. You're not flossing here properly. Hey, you had a trauma. Does that make sense?
If there's anything I've learned from watching you, it's that the area that is hurting, that gets relief from popping, is a symptom,
Correct.
and the area that's not hurting is the problem.
Correct. Very good. Very good. Yes. Yeah, this knot. Very, very, huge knot on this right side, right here. Yeah. Left side feels. This is where your head, in terms of right now, compared to your torso, is on straight, but the bones are crooked. If I tilt you about there, now the bones are level. Do you understand? But your head's tilted. It's that bicycle handlebar tire thing. When you were a kid, your handlebars are crooked to make your tire straight, right? And the left hand is worse, is that correct? That we said the left hand is the carpal?
They're both.
They're both? Okay.
The same.
Sometimes that makes more sense that it's not your lower neck, because if it was just your left hand, it'd be more suspicious that it's your neck.
Sure.
Because your
not
neck,
over there.
you're in avoidance of this, which means you're going to pinch the lower neck on the left. So if it was just your left hand, then I would make a strong argument that it's your neck. But yeah, I know the Phelan's test is positive, so we're gonna work on that wrist in a second too. But we want to alleviate as much stress. Part of the nerve can be sensitized, right? So the nerve can be already upset in the neck, and then it finally gets down through the wrist, and then it gets further aggravated, and then makes the symptom. So that does, even if it is the wrist being the problem, I believe that we can make your spine healthier. If my dad walked in the door, he'd go, "It's always the spine. Fix your spine, Ed. The wrist will get better." So yes, for everybody, it's always the spine. But she's got a positive Phelan's. Oh, yeah, there we go. There you go.
I do that to myself too.
Yeah, we're just trying to. I'm not trying to.
To yourself, to your girl. Sorry.
You really want to know?
Are you? Do you have a rope?
I am a sleigh bed that I put my neck on and I hold my chin
Yes.
and I pull.
Okay. There we go. Chin up. Beautiful. There we go. Very nice. First adjustment. Yay! Easy, easy. Relax here. There you go. Very nice. Gotta unlock. Gotta have the whole 24 vertebrae team. 24, was it 32 teeth? 32 teeth in the middle? So there's 24 vertebrae. 12 have ribs, 12 don't. And so the 12 with ribs are almost always the ones that don't work because they have a rib for the sake of protecting an organ.
Oh, so
Right?
every vertebrae doesn't have a rib.
Like there's
Interesting.
seven vertebrae in your neck, don't have any ribs, and then 5 lumbar vertebrae in your lower back. And so,
Oh, that makes sense.
it's okay. You're focused on teeth all the time, okay?
I'm thinking there's like ones in between your ribs. Okay.
It's okay.
Don't.
It's why I get paid the big bucks. Okay. I'm sure I'd be
Well, the
asking.
other thing is someone's going to say, well, there's 33 vertebrae because they include like those
Well,
ones
the
with
sacral ones are already
ribs.
fused.
Right.
Right.
So
I'm talking about
yeah.
24 independently moving segments. 24 vertebrae, we call them. 7 cervical, 12 thoracic, 5 lumbar. The 12 thoracic, 10 of the ribs are connected to your costal cartilage or the sternum on the front. The last 2 ribs, 11 and 12, are floating, but they still have a mechanical or soft tissue connection to the front. And so 12 vertebrae essentially are protected. It makes sense. They have a cage. And so where is it going to be most prone to overbending? Right adjacent to the cage, right? The vertebrae right next to the cage are going to be the most highly likely to be overstressed because the vertebrae in the cage are stiff. They're protected. And so why aren't we being educated to keep the cage loose, right? To maintain as much motion in an area that's prone to being stiff and shutting down.
That's exactly what I needed.
Yeah, push those ribs
I
down.
get massages, but nobody will go deep enough.
Yep. I do all my cervical work laying down because I want the patient to be able to relax.
Yeah, I could fall asleep.
I want the weight, I want gravity out of my equation. I want postural stresses out of the equation. So anything that's still tight when you lay down is because of guarding, protection, right? If you massage somebody's neck while they're seated, some of the tension could be posture because their head's forward, their alignment's wrong. So it's tense because, oh, you have tension in your neck. Yeah, because the person's head's forward. Yeah, right there is the beginning of that. Those nerves, they go all the way down to your hand. So the marks come out wherever there's stagnation, tightness, stiffness. You're fine, you're perfect. Here we go. It's a component for what aggravates a nerve. Part of it is mechanical compression, part of it is bruising or chemical irritation that the nerve is sitting in, the environment the nerve is sitting in. So as we make the environment, it's like gingivitis, right? So you have a crooked tooth, let's say, a cracked tooth, but then also the gums are inflamed. So all these components elevate the symptom. Okay. And just like you guys do salt rinses in the mouth, I do Epsom salt baths for the skin.
Yeah.
It's the same stuff. Salt.
I
sucks
really
out.
do understand a lot more medical speak in all fields
Right.
from working in dentistry.
Right, you got everything directly. Try to de-inflame the tissue. Okay. I want a bottle of Dr. Ed. That's right. Get out here, Ed, and work on my shoulders. I grew up with a chiropractor as a father. I'm sorry everybody at home didn't have one, or very few.
I know. I'm like almost emotional because that's just hurting for so long.
Yeah.
Yeah, I feel like all the deep places that no one will get, like, it's perfect. Do I have anything coming out?
Oh, yes.
Oh, I do.
Oh, yes. It's like plaque on your teeth.
Oh, I
Okay.
figured.
If you aren't brushing, it's
Yeah.
not very common to imagine somebody going to your office and saying, "I've never brushed my teeth in my life," and then you open their mouth and it's beautiful.
No.
Right? Probably is not a thing.
Nope.
Right? So it's, I've never washed a dish in my life. I've never vacuumed ever. Okay, your house is perfectly spotless. That's amazing. Probably not very
Either
often.
you're lying.
Right.
I floss 3 times a day. No, you do not.
Correct.
sir.
I never lie to my dental hygienist because they know. They know.
Oh, we know.
You guys can't lie to your
The
dental.
last minute,
Correct.
5-minute brush
Oh,
and deep floss does
correct.
not fool us.
That's right. Doesn't fool them. Yes. Guilty. But I'm honest about it. You've been flossing? Not only right before I got here. I've never been able to hide anything from my car mechanic.
Nope.
Never came hide from my dental hygienist. I'm like, it's okay. I had a patient near the beginning of my practice. She lied to me about her age, and it only mattered when I came to bill Medicare one time. And I looked at her paperwork, and I'm like, "Well, you're 55." She's like, "No, I'm 65." And I'm looking at it, like, I pulled out her actual paperwork. She lied twice, date of birth and
my
age.
gosh.
And I'm like, "Okay, so what is your birth date? Because if you want me to bill Medicare, I need to know
I
your
need to
actual
know
birth
that."
date. So you want to be truthful now?" Like I care?
Right.
Well, I'm going to judge you and treat you differently because you told me you're 45, but you're actually 55 and whatever.
Well, I'm only 21.
Right, exactly. Nutrients in, waste out. It's really the word replacement. Our body doesn't really heal. New stuff's made, the old stuff's removed. We call that and term that healing, but it's really replacement. And so your skin replaces, your muscles replace, your bone replaces, and so you're kind of waiting for the new stuff. It's if you cut your skin, the dead cells are dead. It's damaged. You have to replace.
Right.
And so we can expedite it and speed up that replacement process by working on people. So it's, but if you're damaging yourself perhaps faster than your body can replace itself, then it feels like we're not getting anywhere.
Right.
And so trying to change where the stress is going so you can give those areas that are, overstressed a break. Yeah, right here's the thoracolumbar junction, right between the end of your thoracic cage, the beginning of the lumbar. This is supposed to be one of the loosest parts of our back. And when this area gets tight, it creates the beginning of the loss of that lumbar lordosis. We start to round forward. All the weight gets handed off down to the bottom. So right here is primarily what we're trying to unlock. That knot right there, yeah.
Oh, feel that.
Yeah. Hello. I didn't even know that was there until you touched it, Ed. I know. I know. We don't feel the parts of our back that don't bend, that don't work until I ask them to bend, and you feel the resistance and the areas that don't want to bend and work. Now say, no, thank you. Sorry. Your lower back needs you. Your lower back requests your presence. All right. It's worse on the right. This side's got a knot in it, but this one's like about two-thirds or twice the size. Right there. Oh, there it is. Fairly quickly, a couple swipes. That's where the peak of it is where the most stagnation, the most stiffness. Right there.
Does the neck stem from this too? Or are they kind of their own separate things?
Indirectly, it's like dominoes.
Sure.
Like 5 dominoes in a, the first domino hits the second one, and then all the way down to the fifth one. So indirectly, the first domino caused the movement of the fifth one. But directly, it's the fourth domino. This guy directly causes lower back problems. But what creates this, pull this, and then ultimately the upper neck. Yeah, right there.
Can definitely tell that one's tighter.
All right. Oh boy, not the SI joint head. I know.
I'm scared.
I know. We just gotta loosen this.
There's a place, I'm sure you'll find it, when they do my massages where I'm always like, that can't be a muscle, that's a bone. They're like, no.
Yeah, it's a joint. This is the knuckle. I'm really trying to target. Obviously, the muscles are under, on top of it, but.
Yep, right in there. Woo.
I got you. Good. Good, I know it's tough.
It's not as bad as I thought, actually.
Okay, good. Yes. Okay. Ooh, 10 for 10.
Interesting.
All right, you just feel.
Whatever that felt kind of numb.
Lean back a little bit for me. Yeah.
Ooh.
I would traction. I would sit here and just try traction.
Yeah, that feels really like.
Throughout your day, if you can, what I do is I kind of just take the wrist, just grab, and you just almost like I usually will use my chest to help me. And I just kind of push and just try to traction that a little bit.
I feel that, yeah.
Gently.
Okay.
Just try to open that up a little bit. Feel anything in your fingers?
Not really.
Call this Tennell's tap, you know.
Down, when a little bit farther down, I feel like in
A little zinging?
Yeah, in my fingers.
Yeah.
Yeah.
Yeah, it feels a little bit of stress.
Yeah, I feel that.
Some people's nerves are already genetically, I think, hypersensitive. It's like the nerves are already, like the coating on the nerve is not that great. And so it's like the nerve's easily excitable to begin with. Then you can take that and put it in a situation where there's a path that has to get through to get to the hand is always constricted or stressed.
Yeah, I've always played a lot of like computer games too, just Tetris, Minesweeper, all of these little.
He's a gamer. He's like, really? What do you play?
Wow.
Not fun games, lame games, jigsaw puzzles.
Tell me more about Minesweeper. That sounds so fascinating.
Really,
I played a lot of Minesweeper.
Really cool.
I'm one of the top record holders in speed hard mode Minesweeper, okay, Ed? It's a very, very special game.
I actually do know my score.
I knew it.
And it's really good.
Was it 100 bombs on hard or whatever it is? You know, it's tough. Sometimes in those situations, you're like, I don't know, I have to pick one, right? I'm going to have to just, boom!
I know, I hate that. When you can't use logic, you just have to guess.
It's a 30% chance on this one, and it's a 60%.
And then, of course, you have to play till you win, so
Right.
it's like 2 hours later.
Been there myself, okay? As a fellow gamer. I'm not proud of it, but I can say I've been there.
So tell me why your wrist hurt.
Well, we all started with Minesweeper. It was like, that's all we had, right? It was like, when we're in
It's
college, we're all in college, like,
I'm looking back to our dial-up days, and
that's why I played
we had
spades so
internet.
much. I played so much spades because it was like, well, there's online spades included in
Solitaire.
Windows. Right, yeah. Curious if it...
Yeah, this is all where I sit and massage them.
Mm-hmm.
Ooh,
Mm-hmm.
it's crunchy.
Yeah, like right there.
Very interesting.
Right there.
And that is where I feel like this there, and the other spot on my wrist.
There's definitely quite a bit of tension, lactic acid here in the muscles that then
Yeah.
sensitizes the nerve and makes it, again, more excitable at a lesser level of stress. So just a little bit of pressure here, and then the nerve is going numb. So again, that's where I take this all the way up to your neck. It goes down that channel. So every
Do you
place,
think that's all related?
well, every place that we can calm the nerve down will make it less likely to get upset. It's like one final straw that,
So
all right, enough.
doing the pulling, the tension, massaging this, do you think that's helpful
100%,
as well?
yeah. I
Okay.
think this is not good.
I
don't
sit and
like-
massage that, and that'll make things go numb. Or when they're numb, if I
Yeah.
massage that knot, I'll start to
It's
get
a problem
feeling
here.
back.
There's a problem in here.
Okay.
Like I said, repetitive stress, work, and this feels way better out here. And then on your medial side here, it's like, what is that? Who put? That's not good. Yeah, this feels normal.
I have a feeling my right hand's gonna feel the exact
That-
same way.
Something is in there. You almost feel that little nerves upset. All right. Fingers all feel good, nice and spongy, and lean back a little bit for me. Yeah. You think they're saying the same? They're the same. You still feel like they're both are equally when you do phalanx. They both happen. Because that wrist feels way worse
Does it?
than this one.
It's interesting because I'm right-handed.
Yeah, it feels normal right here. That wrist feels good. Let me feel here.
I feel some numbness. That spot,
Uh-huh.
the same spot over here hurts regularly.
It hurt to do that? When you do that?
No, when you were rubbing it, I started to feel some
In here?
tingling and numbness. Mm-hmm.
I'm just curious. Yeah.
It's down right down there.
Right here?
Yeah, that's where I
Yeah.
start to feel.
Yeah, you can't. That nerve can't be that sensitive. All right, well, let's clean it up.
And I don't think it's as bad, but I do feel it there.
Mm-hmm.
What about? It's almost like it's in a little bit more on this side. Mm.
Okay. Like right here, I just not enough.
Mm-hmm. Oh yeah.
I don't like it.
Yeah, it's the same.
Left for me. Uh-huh. And go ahead and tilt left.
Weird.
Yeah, okay. All right, go ahead and tilt to the right. Uh-huh. And go ahead and tilt right. Uh-huh. Yeah. So this is the neck down roll. Just see how it's targeting the upper neck, and sometimes you'll take your hand and you place it on your forehead and you press.
So oddly enough, this is like the exact shape of the bottom of my sleigh bed, and I would sit here with my neck like
Well, then you pretty much have that intuition that this is where it
Yeah.
needs to be pushed on.
Mm-hmm.
So this goes in between the shoulder blades, head back up as you can. There you go. And the idea is you roll in between that shoulder blade. You roll up or down. Then down.
Okay, I love her. I used to put 2 tennis balls in a sock
Yeah.
Oh, now you'll love that.
You
and
roll-
try to roll like this.
Yes.
And I will say, I started watching Dr. Munchausen first.
That's my sister.
Yes.
Yes.
I saw her first, and I was like, I'm going to Orlando. And then I saw her videos with you, and I was like, it's the male version. And he's in Sarasota.
Didn't show your back yet, but yeah.
Oh, wow.
All that,
Oh, wow.
all these marks, this is all,
Yeah.
that's what I'm saying, all that lactic acid in your middle back, that creates the lower back stress. So
Wow. Yeah, that
I'll get
was a
you-
surprise
It's
to me in
plaque,
there.
plaque on your teeth.
Oh, goodness.